Hi, and welcome to this special interview with the Canadian Donation and Transplantation Research Program, the CDTRP. My name is Stephanie, and I'm the CDTRP Communications Manager. It is my pleasure to meet today with Dr. Murdoch Leeies as part of the Pride Month. Dr. Leeies is an organ donation, critical care medicine, and emergency medicine specialist physician based in Manitoba. Trained as a clinician investigator, he serves as the Director of Research for the Department of Emergency Medicine at the University of Manitoba. Dr. leads research aimed at promoting health equity in organ and tissue donation and transplantation. Additionally, he champions equity, diversity, decolonization, and inclusion in his academic and clinical service roles, including as the Director of EDDI for the Canadian Critical Care Society. Recently, he received the PrEP Award from the University of Manitoba Centre for Healthcare Innovation to develop a 2SLGBTQIA+ patient and caregiver advisory team and tackle inequities in the Canadian organ and tissue donation and transplantation system. Welcome, Dr. Leeies. Thank you for taking the time to speak with me today.
Thank you so much for having me.
So last year, you spoke to us during Pride Month about the reasons you were developing a research program with a focus on sexual and gender minority populations and the inequities they face in the organ and tissue donation and transplantation system. What have you learned and what progress have you made since we spoke in June of 2022?
Well, since last year, we've been active in establishing our advisory team. And so this is a team composed of folks who have both a 2SLGBTQIA+ identity, in addition to lived experience in the organ and tissue donation and transplantation system as either an organ donor, as the caregiver of a deceased donor, or as a solid organ transplant recipient themselves. And so forming this team was one of our first steps, because if research and advocacy is going to benefit anybody, then I really believe it's critical for that work to be informed by the people it's intending to help. These are the only people who know what it's like to have a queer identity and to have to navigate through the OTDT system. So with all of the unique experiences and considerations that those intersecting identities entail, they're really best positioned to help us develop research that is targeted to help them. And we've completed a number of projects in the last year aimed at better understanding and characterizing the current state of knowledge and sort of the current policy paradigms in our different OTDT systems. And these have included a novel scoping review that mapped out all existing published literature on sexual orientation and gender identity diverse folks in organ and tissue donation and transplantation. This global review identified, unfortunately, numerous inequities and harms, as well as both knowledge gaps and implementation gaps for 2SLGBTQIA+ people in the OTDT system. Additionally, we completed a national data scan of Canadian organ donation organizations to better understand sociodemographic data collection in practice. And this is really important because without collecting detailed data on different social identities, we really can't evaluate whether inequities exist. And we can't monitor the effectiveness of interventions that we design to try to improve equity. And so this work also revealed important targets for improvement through expanding data collection and enhancing 2SLGBTQIA+ cultural humility training for healthcare workers.
So good. You and your team partner with the Community-Based Research Centre to put out a policy brief that calls on Health Canada to end discriminatory practices in organ and tissue donation and transplantation. What was the reason for this report?
Yes, so I see this report as a call to action aimed at Health Canada, at other system stakeholders, and at the public. After we completed some of our initial discovery phase work, we identified many policies and practices in the Canadian OTDT system that we feel are discriminatory towards 2S LGBTQIA plus people, or are simply insufficiently inclusive of queer people. And so we wanted to highlight those policies in the Canadian context and call on Health Canada to make needed changes. We also wanted to provide a bit of education for stakeholders in the public about some of the inequities that we characterized in that initial phase of discovery work. And, for me, this has really been a lesson in the value of knowledge translation. One of the things that we found through this work is that even just for myself and talking to my colleagues and collaborators who work in the OTDT systems, as physicians, about some of the inequities and harms that we've characterized, so many of these people have said, my goodness, I'm ashamed to say I just never considered this as an issue. And so this report takes that awareness of these inequities to the next level and makes some specific calls to action so that they can be addressed. And I think you're going to provide a link, but you can view the full report at cbrc.net. If you're curious, I would encourage you to check it out. We also have a forthcoming policy comparison piece that compares and contrasts some relevant policies for 2S LGBTQIA plus folks in different OTDT systems. And really, I think, identifies and highlights opportunities to update and to harmonize and align current policies that right now are very discrepant between systems and out of step with current science.
So what are the changes you want to see in the OTDT system, and what is your team recommending?
So we're making recommendations that really have a dual bottom line. We want a system with improved equity and inclusion for 2S LGBTQIA plus folks, but we also want a system that is safer for everybody. And this is a key part of our message, and I really want to be crystal clear about it. We have evidence to show that the current discriminatory policies against 2S LGBTQIA plus folks and the stigmatization of this population result in worse outcomes for transplant recipients. They reduce the supply of needed organs and tissues, and they result in a system, really that is not adaptive to changing or to geographically variable epidemiologic patterns of HIV and viral hepatitis, some of the transmission of these viruses that we're trying to prevent. And so our recommendations for policy updates are aimed at improving both equity and safety in the OTDT system. And so some of the key issues here include updating eligibility criteria for donation. We'd like to see these revised from identity-based criteria, which they are right now, to behavior-based gender-neutral criteria. And this is very much in keeping with what we've already done in the blood donation space. And we've just heard actually in the United States that they're going to be following Canadian Blood Services and Health Canada's lead to revise their blood donation eligibility criteria as well and make them gender neutral and behavior based. We want to enhance HIV and viral hepatitis detection through the use of universal NAT screening. We want to call for systems to denounce stigmatizing physical examination elements. And we want to provide a more affirming and inclusive clinical practice environment through enhanced privacy protections, data collection processes, and through cultural humility training for healthcare workers. And so this year, I'm going to be leading a Canadian national consensus process that's including all relevant stakeholders. And this is going to be a data-driven consensus process with the ultimate goal of making updated recommendations along with the Canadian Society of Transplantation about 2S LGBTQIA plus donors and about our current risk paradigm. And so we'll be making recommendations to Health Canada through that process.
Wow, very much looking forward to these results. Not sure if it's going to move fast, but we hope. So what message do you have for the 2SLGBTQEA plus population for this Pride season?
You know, I think I'd like to say that we see you, that your life and your experiences and your needs matter. The health system has not treated you with the dignity and respect that you deserve. We need to acknowledge that and be accountable to you for that. Whether you're entering the OTDT system as a potential living donor or as a recipient, we should similarly be prepared to treat you with dignity and respect. So you should be secure knowing that we will create a clinical space that's inclusive, will protect your privacy, and we're going to work to develop evidence-based criteria and processes that both improve equity and safety in our system. If you have been generous enough to offer the gift of life through donation, your offer should be treasured and cherished, and we have an obligation to support policy revisions so that our system can respect and honor your wish. And I guess I'll finish by saying happy Pride to everybody.
Yay! Thank you so much, Dr. Elise, for your precious time.
It's my pleasure to speak to you.
Thank you. Please make sure to subscribe to our YouTube channel to not miss any special features like this one. You can also visit our website at cdtrp.ca to learn more on the Canadian Donation Transplantation Research Program. Thank you.